Hello, this video is going to give you a quick overview of how fascia affects our bodies and how massage therapy and craniosacral therapy can help. My name is Kimberly Steed. I'm a licensed massage and bodywork therapist in the state of South Carolina. I specialize in therapeutic massage and craniosacral therapy 1. Below are pictures of my home therapy room where I perform these services. So what is therapeutic massage? Well, the technical definition is a general term used to describe any massage modality that helps relieve pain, reduce stress, and work on specific problems. So what does that mean for me? I incorporate many different massage modalities and techniques into this therapy while I concentrate on areas of soft tissue dysfunction in the body that may restrict range of motion or cause pain and discomfort. This is a type of massage that many people are familiar with. It has many of the same strokes and movements as you've experienced in the past. I also concentrate on something called craniosacral therapy, which by technical definition is a gentle, hands-on approach that releases tension deep in the body to relieve pain and dysfunction and improve whole body health and performance. So what that means to me is that through gentle touch, I use your body's natural craniosacral rhythm to release whole body fascial and membrane restrictions, which allows the body's natural healing ability to thrive. This reduces pain, discomfort, and improves body system functions. So what is fascia? Fascia runs from the very tip of our head to the very tip of our toes, and we can think of it as a netting, as shown in picture 1. It encompasses our organs, it encompasses our bones, it encompasses every strand of each muscle. Fascia is found everywhere within our bodies. So any type of restriction or pull on our fascia can cause a dysfunction in our bodies, meaning that our bodies are not functioning at 100% all the time. You can see by the second picture that a small, simple one pull area of our fascia is probably not going to cause us pain or discomfort. However, there's a little bit of a dysfunction, but our bodies have a natural ability to compensate for 1 or 2 pulls within our fascia system. This is why we don't have pain. Now, pain is caused when we have several different pulls of fascia within our body, hence picture number 3. And pain does not occur at the point of origin of the pull. It occurs at the weakest point in the fascial lines, which we'll explain in a minute. So our bodies can't naturally compensate for several different pulls within our fascia system. Through massage therapy, we release body fascial restrictions through soft tissue manipulation, reducing muscle pain and discomfort and improving circulation and lymphatic flow in the muscle area. Through craniosacral therapy, we release body fascial pulls through a light touch using the craniosacral rhythm and body membrane releases. Therefore, that eliminates the deeper layers of restriction within our body, which allows our body to self-correct, reducing our pain, our discomfort, and improving our range of motion, circulation, and lymphatic drainage. So I mentioned fascial lines of pull. Here's a couple of diagrams that will help explain that for you. The one on the left, we have fascial lines that are depicted in yellow. Anywhere along these different fascial lines, you can experience pain. And the muscles associated with these fascial lines could be the cause of it. So what that means is that if you have pain, say in the base of your skull, which a lot of people have, that restriction can be at the top of your head, or it can be all the way down your back, or it could be down in your hamstrings or even your calf muscles, as you can see from the fascial line on the back along the spine. The picture on the right depicts different lines of fascia. So you can see through the colors that if anywhere along those fascia lines there's a pull, that anywhere along that line there could be pain. So that means that if you have pain in your fingers, it could be coming from your shoulder. If you have pain in, let's say, your lower back, that could be coming from multiple different places on your body. So we use massage therapy and we use craniosacral therapy to help release tension along these fascia lines, which then reduces your pain, discomfort, and increases your range of motion. So how do all these fascia pulls and restrictions and all this pain and everything, how does it really affect your body? Well, the picture on the left is a balanced body. Everything's symmetrical, everything's where it's supposed to be, it all looks great. On the right is an unbalanced body. This has fascial pulls and restrictions within the body. This could potentially cause you pain, some organ dysfunction, some body system dysfunctions, some structural changes within your body. Massage therapy helps to correct your structural and superficial function deficiencies in the body, where craniosacral therapy works deeper within the body on all of the fascial restrictions that you can't reach with massage therapy. So both modalities will work great, but as you can see from the picture on the right, everything distorted. Your face can get distorted, your posture gets distorted, your organs within your body cavity can be distorted, and they won't function properly. So you can see that fascia is a very, very, very important part of our body. And we need to keep our fascia healthy and in line in order for our bodies to be able to function at optimal health. Now, therapeutic massage cannot affect your brain. We can't get our hands in there. We can't touch those muscle tissues. We're not going to do much with it. However, craniosacral therapy is used to balance the fascia that incorporates our brain. And why is this important? Because if our brains don't function properly, nothing functions properly. You can see by the top picture that that's a balanced fascia in the brain. Everything looks symmetric, everything looks great. You got great blood flow, great lymph flow, great craniosacral fluid. Everything looks great. However, on the bottom, you have a lot of restrictions. Your cerebral spinal fluid isn't going to flow properly. Your blood flow is restricted. Your lymphatic drainage is restricted. You could end up with memory problems. You could, who knows? Our brain controls everything. We could have nervous system problems. It's a source of, dysfunction in our body, which we call disease. So by the use of craniosacral therapy, we're able to address these membranes and address the fascia that encompass our brain and our skull area. Whoa, you say you're going to do what to my brain? Relax, I'm not going to do anything to your brain. I'm just going to reset the membranes and the fascia within your brain housing, if that's in the skull. As you can see from the top picture, that when our membranes and our fascia in our skull are lined up properly, everything functions really, really well. When they're not, you can see from the bottom picture, we've got all these divots and movements and pulls and strains within that part of our body. We release the membranes of the skull. We do not adjust the bones of the skull. We release the membranes of the body. We don't adjust anything in the body. What we're doing is releasing fascial pulls and restrictions within our skull cavity and within our full body along our spinal cord. By doing that with craniosacral therapy, we can regulate your cerebral spinal fluid. We can release restrictions, we can release aches and pains. So the main difference between the use of massage therapy and the use of craniosacral therapy is that through massage, we can do a lot of this throughout your entire body. However, using craniosacral therapy, we can also address the functions within our skull and within our spinal column. Thank you for joining me. This was a very quick, basic overview of what therapeutic massage and craniosacral therapy 1 can do for fascial restrictions within the body. For more information, my contact information is on the screen. If you have any questions, concerns, feel free to contact me. Thank you.